So if you first could take us through, I guess, what the first injury was during deadlifting, where it was the L5 herniated disc and the bulging S1 that led to the big surgery, and take us through that for Caleb Farley. Then we'll move forward to present day.
Sure. So the discs in the lower back are basically the bumper pads between the vertebrae, which are the bones, and they're made of two components. One is the outer ring, and one is the inner gelatinous, what's called the nucleus. And when you have stress, like a twisting motion or a lifting motion, it can cause that outer ring, which is kind of like a tire, to rupture or have a tear, and that's whenever a disc herniation can occur. And so likely while he was deadlifting, just had some excessive stress, as these guys do a lot of heavy lifting, and that caused the disc herniation. And disc herniations in and of themselves can heal. However, when they don't, which it sounds like his didn't, then the microdiscectomy is usually the surgery of choice. And it is definitely, any back surgery is a significant surgery. It is an outpatient surgery, and it's one of the kind of bread and butter surgeries of lumbar spine surgery or lower back surgery. And so, that's why I think he did well with it for a while. However, there are risks of recurrence, as we're finding out. And some of those are in the ballpark of 10 to 15%.
Wow. Okay. It's interesting. 10 to 15% of that happening again. The bulging S1, the difference between the herniation and the bulging, what is that?
Sure. So a bulge in and of itself is not too concerning unless the bulge itself is pushing on a nerve and causing nerve pain. And as you age, those discs kind of bulge almost like a little bit of a worn out tire to a certain degree. Okay. But it definitely could have been part of his initial injury.
He got hurt covering a punt, which is what was reported throughout. That's when the play happened, when the injury happened with this recent herniated disc. How are some ways, I guess, in a game for a football player, for an athlete, that like this injury can occur? The deadlifting thing is easy to see, but covering a punt, you're thinking, how do you herniate a disc while you're just covering a punt?
Yeah, that's a very good question. And the amount of force that some of these guys see, whenever they're getting hit, tackled, blocked, and probably if it was something that he could anticipate, with his core strength and just overall athleticism, he would have been able to protect that lower back. However, when you catch a blindside block, or if you get hit unexpectedly, your body's just not ready to accept that force or to protect the lower back with that force. And having had the surgery that he had and the injury down there, he's a little bit more susceptible to that disc injury or getting re-injured.
And so we don't know what disc it was that herniated against Denver a couple Sundays ago. We do know it was the L5 the first time back in the weightlifting situation. Is it likely that it's the same disc that re-injured, or could it be a different herniated disc from the previous injury?
It's most likely the same one. I mean, it's a little bit of speculation, but I would say probably most likely the same one.
Does that add extra concern for you long term? Because Caleb Farley's a second-year pro. He's 22, 23 years old. Does that add any concern long term for what his body can handle moving forward?
A little bit, and once you've had one of these injuries, you are much more susceptible to having another. Like I mentioned earlier, there, at least a recent study showed about a 15% reoperation rate at 8 years. And so he's, within that, 3-year window, and already having 2 back surgeries. And I believe we're seeing, a similar process with Shaq Leonard for the Colts, who is dealing with back surgery and back issues. And he's had 2 surgeries this year. And so it is a little bit of something that, once you have that initial injury, it can predispose you to having recurrence. And so it is a little bit concerning, but I wouldn't say that it's too much doom and gloom right this minute.
What are some things that the athlete needs to be able to rehab specifically with after the surgery to be able to get back? What are the first hurdles, I guess, in this rehabilitation process?
Some of the initial hurdles, is really working through some core strengthening, and isometric core strengthening is one of the main things to protect the lower back, whether it's back pain, whether it's a disc herniation or anything after surgery. And that's something that they'll be working on with him early. And a lot of it at this point, once they do the microdiscectomy, or if they do the microdiscectomy and go through with the surgery, it is just time. And similar to, most of the ligamentous injuries around the knee and in different areas of the body, that disc just needs time to to heal, and it can be 6 or 8 weeks, and depending on the protocol, really can't do any kind of strength training or anything substantial, lifting wise during that time period.
So after the 6 to 8 week mark, you can start adding the strength and doing more. Does that get back into, football drills, or do you still want to see more healing after, that initial time period before you start doing those type of things?
Somewhere in the ballpark of 6 to 8 weeks, and some of it again depends on a number of different factors, but that's roughly the time that I let athletes and some of my patients get back to unlimited and unrestricted activity. Even at that point, it can take some time, especially somebody that's competing at a high level like he is, to get back to 100%. But I think that would be roughly the time frame we'd be looking at.
It is kind of wild that he did play through this injury he missed only the last 2 seasons at Virginia Tech, played 10 or so games, was an all ACC level when he played through the initial injury. Is that a pain management thing, or is there a limitation physically off of what that injury is stopping you from being able to do?
Most of the time, it's pain management. A lot of times with these disc herniations and the nerve pain that can go down the legs is one of the worst things that I see people deal with. People who've had broken bones, who have had kidney stones, patients who have had babies without any anesthesia. They say, I would much rather do any of that stuff than have this nerve pain going down the leg. And so really a lot of it is pain management. Now, there are times where it can cause neurologic deficits and can cause, you lose some strength in the leg, and that is more of a surgical emergency. But being that he was kind of toughing it out, I'd imagine just very tough and pretty stoic to tough it out.
So I guess, obviously you're not working with the Titans, or, you're viewing this from the outside, but take us through the thought process of an athlete who has had back surgery. What the back surgery was. He has a repeat herniated disc. On the decision to put him on the shelf, he's on IR for the rest of the year, let's have another procedure, versus trying to go back through it. What's that process like and decision-making like?
Yeah, I think at this point in the season, and especially in lieu of, and I don't know that would, obviously there are a lot of factors going into decision making, and some of it is his radiographic imaging, some of his MRI imaging, but I would anticipate probably going to be out for the season, and this is an injury that I just worry about rushing people back in. Kind of like I reiterated or mentioned earlier, was with Shaq Leonard, and he kind of felt like they may come back too soon, and when you do that, you just put yourself at risk for then having another reherniation, because that initial couple of months after the surgery is really your highest risk of that recurrence of the disc herniation.
Nate, you are getting some props in the comments for calling him Shaq Leonard. That football, you're keeping up with the times with the name change there from Darius to Shaq over the offseason. Long term for Caleb Farley, so he is young. He's had multiple back issues now, multiple surgeries. I know you kind of mentioned earlier that you're not too worried about his long-term effects, but this guy wasn't exactly playing great cornerback either when he did get hurt. He had been benched for the most part. So, is this something that you feel like he can still recover from physically and be able to be an NFL athlete through most of his 20s to play out his career?
I think that he'll be able to get back to where he was before the injury, and I think as you mentioned earlier, with his age, he's not 19 at this point, but he's still got a lot of youthfulness, and I think that he will be able to rehab. Cornerback's a tough position on the lower back. When you're backpedaling and you're trying to twist the hips and twist the lower extremities and turn those hips and try to cover some of those guys, there's a lot of torsional force on the lower back. And so, there is that chance that he's unable to quite get back there. And then the question is, does he switch positions? Does he do something differently? Because
he played wide receiver some in high school and early in college. And some people think because of his size and his length that maybe safety could be an aspect where do those two positions have less stress on the lower back, or is it about the same?
I'd say just a little bit different coming from the safety position. You're coming downhill a little bit more. You got to have a lot of field speed, which he does have, and it's a little bit less rapid twisting motion on the lower back, but it's still, unfortunately, there's not a really a low impact position on the football field.